Well, I call anxiety the greatest mimicker. It is truly a chameleon because it can look like so many different things. And that's why it is easy to miss. So I think parents need to give themselves a little bit of grace that this is not hard for pediatricians to diagnose, so certainly for parents to immediately recognize. I see anxiety that looks like inattention, like ADHD. I see it look like OCD and compulsive behaviors. It can look like temper tantrums. I've seen anxiety look like appendicitis with severe abdominal pain. And so understanding that anxiety has three components. It has behavioral, it has physical, and it has emotional. And parents can see behavior change, they can see physical symptoms, but we can't read our kid's mind. It's very hard to find that third component. So identifying anxiety is going to take some time. It's watching for patterns. It's watching for situational patterns, reaching out for help if you need it to help define it further. But most importantly, it's addressing and validating that feeling that they're having. It's directly managing pain or discomfort they may be experiencing, all while continuing to observe and watch and then bring it to your pediatrician or mental health provider if you're worried.
Parents often ask, and I was asked this after I debuted the other episode about functional abdominal pain, how do I even talk about anxiety without making it scarier for the child? So how do you guide families to explain anxiety in a way that helps children feel understood and supported and not scared of what's going on in their body and their mind?
Anxiety is normal. There is nothing to fix, and their child is not broken. They have a very special brain that has a superpower. Anxiety is a superpower. Their brain is extra good at noticing things and thinking about things. And so when those symptoms get too much to handle, it's just practicing and teaching our brain what to pay attention to and what to relax and when to relax.
Welcome back to the show. You are watching the Peds Doc Talk podcast here on my YouTube channel. And thank you so much because we have reached silver status on our YouTube channel. Thanks to you. Thanks to the fact that you subscribe, share these videos, engage in the comment section. It all really helps the show and the channel continue to grow because I love being able to bring amazing guests to the podcast. And today is someone who I'm surprised has not been on the show before, but the timing is perfect because she's talking about her new book and a topic that she's very passionate about. Her name is Dr. Natasha Burgert, pediatrician, author of Managing Childhood Anxiety for Dummies, a Wiley brand. So the whole theme of the For Dummies brand, but it's not just for dummies, just so you know that. And an all-around guide for parents navigating childhood anxiety. She's based in Overland Park, Kansas, and Dr. Berger balances decades of hands-on pediatric care with a knack for making mental health feel approachable and doable for real families. Her new book, Managing Childhood Anxiety for Dummies, distills what she's always wished she could say during packed 20-minute appointments. I've been there too, talking through what anxiety actually feels like, looks like, when to act, and how to support our children step by clear step. Natasha is also a trusted voice behind and beyond the exam room as a national spokesperson for the American Academy of Pediatrics, a former Dear Pediatrician columnist in Forbes Health, and a digital health communicator known for making evidence-based insights with empathy, a dash of humor. Natasha, I'm so happy that you're finally on the show today to talk about this. Thank you for joining us and congratulations on your book.
Thank you so much, Dr. Mona. It's great to be here.
I know that the work that goes into this is something that is not often talked about enough. People don't realize the time, the sweat, the thought process, the editing. Really, I'm so happy. And for anyone who's not familiar with who you are and what made you write this book, why did you, as a general pediatrician, choose that this book on anxiety is what you needed to put out into this world?
Well, any pediatrician today knows that a large chunk of our pediatric practice is mental health and helping families navigate emotional and behavioral disorders. And so it kind of came at a great time for me because as anxiety was rising for my patients individually and as a nation, I really wanted to create a tool so that parents could reach for a book that gave them evidence-based information about what anxiety was, but also things that they can do at home before they even talk to their pediatrician, and to give them very important details to know when they need to reach out for help, and if they do get a diagnosis, what exactly they need to do in order to support their child.
Well, absolutely, very timely. I'm so excited that I could get you on the show and release this fast. People don't know this, but I don't always release my recordings within a week. But I'm like, I wanted to get you on. Also, for anyone who's interested, I had recorded an episode with a GI psychologist about the gut-brain connection in anxiety, and it was that episode that prompted so many questions from parents about a deeper dive into anxiety and maybe just more about it. And I was like, well, guess what? I have this amazing pediatrician who wrote this book. So why don't I get you on and just bump up this episode so that we can actually talk about the questions that my followers had, and I also get in my office, and it is really important, like you said. I mean, I think people forget that pediatricians are not just boo-boo fixers. We're not just people that you come to for a cold. We actually are dealing by and large more with this anxiety, depression, school avoidance, whatever it may be, mental health concerns from toddlers and up than
Yeah.
people realize. And so
Mhm.
I think one of my first questions that I wanted to ask you, because parents are often wondering what anxiety looks like in children, because it doesn't always show up just as worry. Sometimes it can be stomach aches, trouble sleeping, irritability. So, in your book, how do you help parents recognize the signs of anxiety, especially the ones that might be easy to miss?
Well, I call anxiety the greatest mimicker. It is
Mhm.
truly a chameleon because it can look like so many different things. And that's why it is easy to miss. So I think parents need to give themselves a little bit of grace that this is not hard for pediatricians to diagnose, so certainly for parents to immediately recognize. I see anxiety that looks like inattention, like
Yeah.
ADHD. I see it look like OCD and compulsive behaviors. It can look like temper tantrums. I've seen anxiety look like appendicitis with severe
Yeah.
abdominal pain. And so understanding that anxiety has three components: it has behavioral, it has physical, and it has emotional. And parents can see behavior change, they can see physical symptoms, but we can't read our kid's mind. It's
Yeah.
very hard to find that third component. So identifying anxiety is going to take some time. It's watching for patterns, it's watching for situational patterns, reaching out for help if you need it to help define it further. But most importantly, it's addressing and validating that feeling that they're having. It's directly managing pain or discomfort they may be experiencing, all while continuing to observe and watch and then bring it to your pediatrician or mental health provider if you're worried.
I love it. And again, the book is so well structured, and I love it that it goes into, again, how to understand the signs, and we'll get into more about, obviously how to talk to the children about it and treatment plans and all of that. But it's something that you're really going to want to get. I love this because I think it's just going to help me better understand my patients as well. So thank you for writing it. I always love learning about mental health, and I'm sure I'm going to even learn something more from this conversation that we're about to have, but also from your book. So I say that as someone who's a lifelong learner, that I am just so grateful that you got this out and that we're going to be talking about this.
Awesome. And I think that that's really important. That's why I learned even more when I was writing it. I mean,
Yeah.
that's the part of being a parent, it's part of being a professional, is constantly being open. So thank you.
And anxiety can feel overwhelming, not just for kids, but for parents too. I have it myself, so I'm very well aware of how that can feel in my body. Parents often ask, and I was asked this after I debuted the other episode about functional abdominal pain, how do I even talk about anxiety without making it scarier for the child? So, how do you guide families to explain anxiety in a way that helps children feel understood and supported and not scared of what's going on in their body and their mind?
Anxiety is normal.
Mhm.
There is nothing to fix, and their child is not broken. They have a very special brain that has a superpower.
Yeah.
Anxiety is a superpower. Their brain is extra good at noticing things and thinking about things. And so when those symptoms get too much to handle, it's just practicing and teaching our brain what to pay attention to and what to relax and when to relax. When
I
I'm
love that.
talking
Yeah.
when I'm talking to parents, I also love the smartphone analogy. I don't know if you've heard this one, but
Mhm.
when I have my smartphone going, I have it set so that I'm only getting important notifications. Things for my kids, weather alerts, when Taylor Swift drops an album. I mean, things that are going to be really
Yeah.
important to me, right?
Yeah.
Because every time my phone alert goes off, it excites my nervous system. I jump to my phone,
Mhm.
I grab it, I want to look, it distracts me, it guides my attention. What would happen if my phone had every single notification on for every single app and every single news service that I subscribe to? It would be so overwhelming. I'd be constantly engaged, be constantly worrying what's important, what's not. I'd be in this state of alert that becomes distracting and tiring and annoying, quite honestly. But I'm not going to throw my iPhone away. The iPhone's not
Right.
the problem.
Mhm.
We need to learn how to manage those notifications, and that is managing anxiety.
And this month, the AAP released a new report recommending that pediatricians screen for mental, emotional, and behavioral health concerns at every checkup starting at 6 months. Why is this such an important step for families, and what does effective screening actually look like in practice? And parents might be like, "What does that mean for a 6 month old?" When do you think that we should really starting to ask these questions or be on lookout for anxiety symptoms?
Pediatricians are all about prevention, right?
Mhm.
So the earlier we identify problems with mental, emotional, or behavioral issues, the earlier we can give support to families. And that's why this is important. So this clinical report is readdressing really what we're already doing. We're looking for maternal and paternal anxiety and depression during the early months. We're looking for autism spectrum disorder during early childhood. And
Yeah,
then beginning at age 3, we're annually now screening for other issues. In my office, you are screening by asking questions. Do you have a problem? Right? That's the first thing we certainly ask. I'm also asking the kids directly. Do you have
yeah.
problems with headaches? Do you have problems with stomach aches? How are friends at school? How are things going? And then as kids get older, they can actually fill out forms and do screening tests on their own, which can often reveal some challenges that they're having. It's important for parents to know that just because they have a positive screen doesn't mean they have a diagnosis.
Right.
And so I don't want families to feel like we are doing this to find something wrong. We are doing this to find them help and support where they may need it.
And you mentioned already, and I love the way you talked about that anxiety can be this great mimicker, right? That it can be other things. And then obviously our role as a pediatrician, which I know you do, I do, is always thinking about mental health components in our differential, right? So using the example of abdominal pain. If a child's coming in with abdominal pain, just started school, dealing with it on the weekdays, we are asking the questions. We're obviously ruling out anything organic, but we're also having the conversations around mental health, emotional well-being. And so we can screen this a little bit earlier. And I love that you mentioned that the forms don't always mean everything, and they don't always mean a diagnosis. I think parents have an interesting phobia of getting these labels put on their children, and I don't know if you felt that as a pediatrician. And what would you say to those parents who are like scared to bring up that their child has anxiety? What would you say to those people?
Again, screening and asking questions is not a diagnosis. We're helpers. We've always been
Yeah.
helpers, and that's our job. And so we're here just to give you support that you may need or to ask you more questions to tell you that this is normal. And maybe you're worrying about something that you don't need to worry about. So we're not here to label kids either. We just want to make sure that kids and families get the support that they need.
And I'm happy that we're talking about this because obviously you talked about your inspiration of the book. You talked about how we've seen this rise. We've seen that 13 to 20% of children have a behavioral or emotional disorder at any given time, and anxiety seems to be on the rise. Why do you think anxiety is climbing? I don't know if you go into that in the book, or do you have your own, from your own research that you've done or clinical experience that you see this sort of pattern that we're seeing it? Is it more awareness? Is it more of societal expectations? What is it in your opinion?
It's all of it. I think we
Yeah.
still have a pandemic effect. I think we can't ignore screens in the room. I think parental stress is at a high, and when we're stressed, our kids get stressed. And it's hard to be a kid. Like there's
Yeah.
insane academic pressures. The youth sports machine is causing
Oh,
a ton of anxiety and pressure with these kids. But just like we mentioned through the academy, also better
yeah.
science, better screening. We're talking about it
Yeah.
more, and we're getting these kids the help they need.
You brought up a lot of the things that I'm seeing. And I love that you have that in your book as well. But yes, the ever ending need to do things and lack of boredom and the need to constantly be on. I mean, how is our brain ever going to be able to close down those windows? Using your smartphone analogy, it literally is like something's always ticking in the brain. I got to go to this sport or I got to do this. And I think it's so nice that if a child's passionate about something, but it is on a parent to kind of look at, is this borderline too much for the child, or is this something that is serving them well? And so with so many different things, I mean, in terms of younger children, I love that you brought up the parental mental health, because I've always felt that even in the postpartum period, I've talked about postpartum mental health, the importance of both partners taking care of their mental health in a time that it can be hard to, because you have to now take care of a
Mhm.
newborn. And parents often want to know, with anxiety or behavioral or emotional disorders, did I pass this on? So, how much of anxiety is genetic or nature versus nurture? How much of it is observed? And what other factors can put children at greater risk of developing an anxiety disorder, knowing that there's so many factors to it? I know this is a loaded question.
Well, genetics play a role, there's no doubt.
Hmm.
But it's very, very clear that parents do not give their children anxiety.
Hmm.
Kids have developing brains. They have periods of time in their life when they're just going to be more prone to being more emotional versus a cognitive thinker, which is going to be a setup for a time of life when they may be more anxious. Kids have innate temperaments or the way they perceive the world that makes them more prone to anxiety. And I really enjoyed, when I was writing the book, learning about epigenetics, or
Yeah.
the study where the study of how genes are turned on and genes are turned off. And that's why I devoted so much of the book to environmental factors. These are things that are important to optimize the mental wellness of our kids and turn those anxiety genes off or down. There are things like sleep and nutrition and play, not being overscheduled, like you mentioned,
Yeah.
behavior management, like calming our own nerves, that affects their genetic expression. So if you have a kid that is prone to anxiety, my mom was anxious, I'm anxious, I have a kid who's anxious, I want to set up that environment the best I can to turn as many of those genes off and make their experience of anxiety easier for them to handle.
I love that. I'm very fascinated with nature, nurture, and obviously what you said about epigenetics. And I love that you're talking about the environmental factors and very foundational things. I mean, you didn't bring up anything that's outlandish, right? The importance of sleep, the importance of not overscheduling, the importance of nutrition, play. I mean, children need that in their lives for healthy emotional well-being. And also, you mentioned parental mental health. I think is obviously something very important as well. And I think a lot of parents that I feel, come into the office, and we had alluded to the labels and, like, filling out the forms. And sometimes the forms don't match what I'm seeing in my office. For example, I do believe that a lot of my teenagers sometimes will fill out the forms just to fill it out, or a parent will fill it out for them. And one of the feelings that I've heard, or one of the sentiments I've heard, is that I'm afraid to bring up anxiety because my pediatrician is just going to suggest medicine right away. Or I don't want to go see a therapist because I don't want my kid on meds. You and I both know that that is not how this works. Neither of us, and many of my pediatricians that I know, are not going to always go to meds as first line for anything. Usually we like to do other approaches first. But can you walk us through what actually happens when a child screens positive for anxiety, whether it's through conversation, which is how most of my diagnoses start to happen, the forms, and what are the first steps a family can expect if there's a concern, and why it's important to bring it up in the first place?
Yes, I couldn't agree more with you, Dr. Mona. Meds are never the first thing that we're thinking about. And if you do walk into a place, quite honestly, and that's the first thing they suggest for typical child anxiety, I'm going to turn around and run, because
Yeah.
that's not evidence based and that's not what we're wanting to do with these kids. If you screen positive, that doesn't mean that does not mean that your child has a diagnosis. So it is going to be more questions, more questions, more questions in order to determine what symptoms that they are describing are affecting their life function.
Yeah.
So how is this affecting your family? How is this affecting school? How is this affecting growth and development? How is this interfering with the things that kids want to do or need to do or love to do? And
Yeah.
since anxiety is normal, you can have anxiety and thrive with anxiety and not need any additional supports. But we have to ask those questions to see how it interferes with their life and what they love and want to do. And that will determine a comprehensive treatment plan for these kids.
And I love that you already mentioned how to talk to the child about their anxiety. Obviously, like, making it very normal. One of my favorite movies of all time is Inside Out 2, that had the scene with anxiety and really normalized, like, how anxiety can be a very good thing unless it takes control, right? Unless it takes
Right.
control of the control system, control center. But like any other emotion we have, anxiety can be protective and it can be helpful. But you said it beautifully, that if it starts to overtake activities of daily living, how that child's showing up in school, peer relationships with their parents, that it's something that we want to evaluate and get them help for.
Absolutely.
And it's still sad to me that we live in 2025. I have been very vocal about the fact that I see a therapist. I've been on medications for anxiety and depression in the past. And just like we would want any child to get help for their diabetes or for anything else that they're dealing with, we would want that same level of care for their anxiety and their mental health. And whether that means needing a medication down the line, being open to having the conversation and having the parent on board is the first step. And I think you've probably been in those situations too, where I feel like the child is dealing with anxiety or depression or some sort of mental health concern, and the family is giving me pushback. And I just really want to say that in order to allow this child to live their full potential and be happy in their skin and feel content with their feelings, we have to address the elephant in the room, which doesn't have to be the elephant in the room. Anxiety does not have to be a thing that we push down. And it's sad that even in 2025, it's still something that's so stigmatized.
No, it's true. And I think thankfully a lot of families are just a lot more willing to talk about it, but it is kind of myth busting. And that's where I try to do, especially when you're talking about medicines and early diagnosis, we have to kind of get those myths out of the way so that we can come to the table with our pediatrician, our trusted health expert, and be able to ask educated questions and really get to the matter of what's worrying you. Because we are here to help and navigate. We're never going to recommend something for your kids that we wouldn't do to our own. And so bring those questions, have that framework of what you're trying to ask and what those concerns are, and help us, and we can help clarify and kind of clean that windshield a little bit for you so you can make a good decision for your family.
And I have prescribed SSRIs for teenagers and children in the past, and I think you have as well. But I do want to talk a little bit about medications because SSRIs are often in the headlines, and parents have a lot of fears. And a lot of these fears can come from social media creators that aren't well versed in the field. How do you address questions like, do kids really need medicine for anxiety if it gets to that point? Are these medications safe? And what do you want parents to understand before making these decisions, whether it's with a pediatrician, whether it's with a therapist, or whoever is the prescriber?
Sure. I devoted a whole chapter of my book to medicines because I think it's really important for us to get facts over fear. And I think whenever we're talking about giving a medicine to our kids, it can be scary, whether that's an ADHD med, an anxiety med, or even an antibiotic. We want to know what it's doing in their body and how it's changing things. But I think it's important to recognize that most SSRIs are simply tools. We're already trying to use different tools in order to get their symptoms into remission. We are trying to do therapy, we're trying to do environmental and school supports, and sometimes that's not enough. Their emotional brain is simply too strong. And so we can use those meds as a tool to help the work of therapy and the work of environmental supports work better. Sometimes our kids need medicines when they're unable to participate in therapies or when symptom severity gets super high. But it's important to know that there's been decades of research here. There's been decades of clinical work with these. When we prescribe medicines of all type, we're doing that in partnership. We're doing that with a common goal of getting symptoms under control, knowing that we can change course if things are getting uncomfortable. And the most kids don't need SSRIs forever. They need it as a tool to make the therapy work better so that they can strengthen the brain parts they need to control those anxiety symptoms. So again, partnership and getting facts from people who actually prescribe these medications and are current with the updated guidance.
Briefly, do you want to explain to anyone who's not familiar how an SSRI works on a biochemical level, like what it stands for and why it can help in something like anxiety or, obviously mood disorders like depression?
Sure. So
Yeah.
what I tell my families is that serotonin is responsible for our emotional heightenedness, our emotional responsiveness in the emotional centers of our brain. And so when we take SSRIs, what it's doing is it's just boosting that level of that natural hormone that our brain is already making. It's not giving you any extra. It's just boosting what you already have and optimizing that so that you can use that hormone in that emotional center. So maybe you only go from 0 to 50 instead of 0 to 100. And so in that moment, you can use your calming mechanisms, the tools, your co-regulation, your self-regulation techniques that you need to learn in order to change that pathway. And over time, the goal is to increase that serotonin level so that we can reinforce that good, healthy pathway, which does take time. But
Yeah.
once that good neuronal pathway is established, then we can back off on that SSRI support. There should be a good entrance plan, a good exit plan, while we're trying just to support the natural hormones and that natural brain growth that happens over time.
Yeah, bringing back the point again that in order for us to make changes for your child, we have to know that they have this issue. So that's going back to the importance of knowing signs, having the conversation with your pediatrician, because that's usually going to be the first line to either get the diagnosis or refer you to someone who may be more well versed in medication. I do want to add, and I think you would agree, that not all pediatricians are as well versed in anxiety as others. So it's important to ask your pediatrician what the next steps are, right? Like, what, in terms of, if they have a diagnosis, is it going to be you that helps me through this? Am I going to need someone else? And finding the best referrals that are going to be that sort of holistic approach of what can we do environmentally, what can we do behaviorally, and then when will medication need to be in the picture so that it supports the parent and the child.
Absolutely. The kids require a team.
Yes.
Anxiety needs a comprehensive approach. And so it's not just one thing that's going to help, it's a combination of many. And that's what kids deserve. So, yes, ask your pediatrician questions, because there are some that don't manage mental health, choose not to. But they will have resources locally in your community that they can refer you to.
Yeah, and going back to the medication thing and what you just described, I didn't realize that until it happened to me, and I am very much that type of provider that does a very very low med approach initially, right? What can we do in terms of behavioral therapy? What can we do in terms of therapy, not only for things like anxiety, but also things like ADHD,
Yep.
right? That same thing that you mentioned, a lot of my parents have the fear of ADHD medications. And having had anxiety and still having it, but having needed SSRIs, I remember saying, I don't need it. I pushed it away. There was a stigma that existed culturally for me to need any sort of pill to help me with my mental health. And like you said beautifully, I was doing the therapy, but it wasn't easy to get into therapy every week because I was busy postpartum mom, working clinically in a pandemic. And getting on that SSRI in my life saved me, because it was that bridge to get the tools, get the therapy, have the therapy start to work, and then I was able to come off of it. And in my reality, I want to share this because I love being personal on this podcast. I now only have to be on an SSRI in the summer in Florida because I get reverse SAD, which is reverse seasonal affect disorder, which is a thing, guys. And I say this because I shared it on my stories the other day and someone had said, "Ew, you're on an SSRI?" And I'm like, "Ew?" I'm like, you're saying ew. I'm saying I'm living my best life because I am in therapy. I'm so happy, but I have this thing that helps me for the season when I need it. And I'm able to taper off of it with the guidance of a clinician and get off of it and feel happy. And there's no shame. And I say this because it's not always going to be that your child needs the medication, but when you have the right doctor and the right therapist, it's going to make sense when that needs to come into play and maybe when it's going to need to be weaned off. And our goal here is to support your child, and that means also supporting the family, because we know that anxiety affects everybody, right? Mental health disorders can affect everybody in the household, and we want that to be better for everybody, and especially the person who's dealing with it, so that they don't feel like they have to struggle in silence, because that's more risky than being on an SSRI, in my opinion.
I mean, and how many times have you heard, Dr. Mona, after you work with a medication to get symptoms into remission, what do the parents always say? I should have done this 6 months ago.
Yes,
I should have done this
absolutely.
a year ago. And I think we fight, but this is a safe and effective tool as long as it's in partnership with a prescriber who understands your family, understands your goals, understands your child's physiology and their symptoms, what they need to accomplish in their life. I've certainly, as you have experienced, I have certainly also seen kids whose lives are changed. Their trajectory of their
Yeah.
anxiety is changed permanently. And in some cases, SSRIs have saved their life.
Yeah, absolutely. And I can't go back. I can't repeat it enough, the importance of the team. And I wish we had better mental health resources out there that do that for us, like and that's why I think your book is so important, that has the education, but also the empowerment, also the understanding of the holistic approach to this, that isn't shameful, that isn't like, well, I can't believe you're on an SSRI, that, hey, this may be the tool that you need to get this under control so that you can live the life that you want, right? That anxiety isn't taking that control, the control tower in Inside Out too, because we're fine with having it, but we don't want it to be in the driver's seat at all time.
100%.
The other thing that you mentioned was, and I love that you brought up that that you have anxiety, your mother had it, you see your child have it as well. You make the important point also that a parent's own mental health and anxiety can influence how well they're able to support their child sometimes, right? Maybe they're nervous about how they were dealt with, or maybe they are unsure what's going to happen. How do you encourage parents to reflect on and address their own mental health while also trying to help their kids in this situation?
Parenting when you have anxiety is so much harder. And I do think it's reciprocal. So if you
Yeah.
have anxiety, you can put the gas on your kid's anxiety, but also a child having anxiety can also make you anxious. Like
Yeah.
it's a very important cycle to recognize. And I know we've always heard the adage that anxiety is contagious, which I think has some elements of truth because kids do pattern our behaviors. But anxiety also interferes with our parenting in a few ways that most parents maybe don't recognize. And that is, it decreases our parenting effectiveness. It
Yeah.
increases our willingness to do accommodation. It changes our parenting style. Anxiety will anxiety will change our emotional interpretation. So we often overreact for things that we shouldn't overreact to. It also interferes with our relationships. I mean, anxious
Mhm.
person, I know when your anxiety is uncontrolled, you're irritable, you don't want to be around people, you feel drained, and that does not
Yeah.
help with the relationship with your child. But I think most importantly, anxiety can really steal joy. So if
Yeah.
I have a child where we have a really nice comprehensive medical plan for them and things are not changing, we have a frank conversation that something in the environment is not allowing your kid's symptoms to go into remission. And is this a space where getting your own anxiety under control is the best thing that you can do for your child's anxiety? And that can often make all the difference in the world. It's not an easy conversation.
Mhm.
It does require relationship, which fortunately most general pediatricians have with their families to know them well. But I think it's a point of honesty when things are not going in the direction that you want them to, that we need to reflect on.
And I think your point is valid that it's not a blame or shame thing. I think, I, as someone who does have anxiety and can see not even just my anxiety, but when I'm irritable, when I'm overstimulated, all of the manifestations of my anxiety, when I see how that impacts my child, that's not blaming myself. I don't feel like I'm a bad mom. I don't tell myself, well, Mona, you're horrible. It's insight, right? It's understanding that, yeah, when I'm running around my house with like a chicken with its head cut off, that doesn't bring energy into my home. My kids start feeling that, right? And I think it's important for parents to hear that we, neither of us and neither any of our colleagues, have ever felt like this is a blame or shame game, but it's having the understanding and the insight to saying, like, how am I showing up for my kid in this moment, right? If I have anxiety, if I have ADHD, if I have whatever I'm dealing with, my kid is going to absorb that because it's very contagious. I mean, energy is palpable. I
Mhm.
mean, you don't have to, like, people think that you have to be a certain type of personality to feel energy, but I know when you walk into a room and you feel that sort of stress. You've been in those visits, Dr. Natasha, where the moment you walk in, everyone is this, the baby's crying, that situation, the baby's crying, they're passing the baby around, everyone's stressed, and then I just sit down, and all of a sudden we're all relaxed, the body's calmed down, and the baby stops crying. Is that going to happen every moment a baby cries? No, but it goes to show you how palpable and how strong that emotional connection is, and just having that self-reflection, saying, am I bringing anything to this? Maybe you're not, and if I am, what can I do to better provide for my child in this situation? Maybe it's my partner bringing them to visits, maybe it's my partner or someone else helping them with other things. It's not a I'm not a good mom or I'm not a good dad. It's a understanding of self, and I think that's a huge thing that I wish parents would understand.
I think that that's such a great point and so eloquently spoken. I think it's also just a reflection of being a human, right?
Right.
We're changing and growing just like our kids are. And I think we don't stop to self reflect because we're so busy in their life and
Yeah.
making sure that their life is okay that putting those steps to reflect on our own lives as we're changing as an adult is equally important and is going to serve us well when our kids leave the house, right? Like
Yes.
we need to keep building and growing as an individual, and that includes our mental health, our interests, what we prioritize, even beyond what's happening in our kids' lives.
Oh, it's so beautiful, and I'm just so again excited about people getting their hands on this book. What would be any other myths that you'd like to debunk right now regarding things in your book, anxiety in general that we didn't cover yet that you wish our listeners would know?
Well, I really think that parenting is a verb. We're constantly changing. We're constantly growing, and even though our kid may have anxiety, and that's not necessarily what we planned for, we don't wish anxiety on our kid. We have this great opportunity to grow and adapt with them in order to learn how to parent an anxious kid. Kids can absolutely manage their anxiety. They can do it on their own. We just need to give them the validation, support, the love that they need in order to be able to learn how their brain works and learn how they are going to independently function in their lives. And there's a lot of tools and resources out there that are going to be able to help that.
Oh, like your book. Oh, thank you. Not Dr. Natasha, I really appreciate you coming on today. I know we're debuting this episode at the start of a school year. What is it about the start of a school year that you feel like, I mean, I notice a lot of my anxiety concerns come in September, October, November. What is it? Is it the relationships? Is it the workload? I mean, we already kind of alluded to it, but I know that it was important to get this episode out now because I see anxiety skyrocket a little bit now. But what do you think it is that's happening for our kids?
Oh my gosh, it's everything, right? And
Yeah,
it's also just the transition because kids love the summer
I
and they're
know.
stressed out that school is starting. So it's anxiety, and those physical symptoms can come from great things too. It's just they get sad that summer's over. So I call this season abdominal pain season because that's
Yes.
like kids always get stomach aches, and God bless the school nurses, they're angels out there because they're dealing with all of these kids coming to the school nurse with abdominal pain and headaches this time of year. It's normal. Or just like you had a great guest on that explained the gut brain connection, this is a very real change to their physical body when they start to have stress and transition. Pain deserves to be appropriately recognized, directly treated, and then continuing to work forward to keep those kids in school and to get their symptoms better.
And that episode, I will be linking that in the show notes as well. It released a couple weeks ago, but me and Dr. Ali Navidi, he's a GI psychologist. We talked about how to talk to the kid about their abdominal pain, what we say to the kid, so that they understand that the pain is real and how it's obviously impacted by their emotional well-being, so that it's not gaslighting your child. It's not saying that the pain's not real, get over it. It's like, hey, this is a real thing. But thank you so much, Dr. Natasha. This was an amazing conversation. Where can people go to get this book? I'm holding this up for anyone who's not watching the YouTube. But again, it's Managing Childhood Anxiety for Dummies, a Wiley brand, which is obviously their series of the For Dummies series. But where can they get that? And where can they go to stay connected with your work?
Sure. You can get the book wherever books are sold. So I would love for you to check it out. And then I also share things on Instagram and Substack, and you can connect with me at kckidsdoc.com.
I will be linking all of that. Again, please make sure that if you love this episode and you learn something, to subscribe to the channel, share this information. The reason why I want people to share is not only does it help the show grow so that I can continue to bring amazing guests, it's because I want more parents to be educated about these things too, right? I get these amazing conversations with super smart people on my show that why let it go to waste? So if you learn something, it probably means someone else can learn something too. So share it, share the social media promos that we do so that more people can feel better supported in raising their children. And I cannot wait to have another guest next time on the Pete's Doc Talk podcast. Stay well, everybody.